Hello po and magandang hapon. Happy Fiesta po. Dito po sa amin, Barangay San Juan, San Luis, Pampanga, Viva Apong San Juan, nakapiesta po kami. So basaan po dito and nabasa na po ako, naligo na and now ready to do the talk show. So welcome. I'm Dr. Ana York Bondoc. Ito po ang libreng konsulta. Please follow us on YouTube po. We are trying to reach 1,000 subscribers. And we are also trying to have more views. So please follow us on YouTube. Live din po kami doon. And live din po kami sa Facebook. Ilagay niyo lang po yung mga tanong. And I will do my best to answer them. COVID and non-COVID, we are willing to answer your questions. I would like to greet a special happy birthday po to Barangay Captain Mighty Carlos po from San Luis. So kay Cap Mighty, happy birthday and hoping that you're enjoying. Katatapos lang po ng piyesta ni Cap Mighty, naka-lockdown po sila, kami ngayon naka-lockdown. So nobody can come in and out except kami. So nagbabasaan lang po kami rito ng magbabahay-bahay. So sa inyo po, good afternoon. Our topic is very important and very timely. Ito po ang tinatawag po nating Delta variant. Ano ba ito at ano ba ang magagawa natin to protect our country and ourselves from this dangerous new variant na lumabas po and has exploded throughout the world. So tara po, please join us. We'll have a short talk on the Delta variant and later on you can give us our questions. So I made a few guidelines po for our talk, Delta variant. Ano ito? So would you please flash po yung number 1? So, okay. Bakit nga ba? Bakit may alpha variant, may beta variant? Diba dati may UK? So, these variants po, they were renamed by the WHO. Ito po yung mga mutations of COVID. As I said nga po, COVID mutates. Habang dumadami po, as the COVID virus is mutating or reproducing in our body po, kuminsan yung reproduction niya is not exact. So nagkakaroon po ng, would you mind to take out the alpha variant? We are not talking about the alpha variant. Question, there's discussion point letter A. Bakit ba may variants? Yes, what is the variants? At ba't na iba po yung mga words? I'm sorry, kuminsan mahirap po talaga in live. So basically, as we go through po, as it reproduces, ano po, hold on lang po para malaman po nila. Parang nawawala po sila sa ating po discussion points. I am resending them. Okay. So questions. Bakit ba nagkakaroon na iba ang pangalan ng variants? What happened to the names of the variants? Where is the UK, the Brazil, the South African? Okay. So, ba't nga ba na iba ang pangalan ng mga variants? Well, in May po, this was changed by the WHO kasi po, we used to name the variants by place. Of course, discriminatory po yun. Kasi hindi naman ho, dahil dun lang ho discover, kasalanan na ho nila yung variant. So, they changed back to the numbers. Kasi po, they also named the variants as to where po nagkaroon ng mutations. Pero it was very confusing kasi ang haba-haba ko nung name. So, to make it simple, nagkaroon na po, they decided to name it alpha, beta, gamma, delta, ganun po, after the Roman alphabet. Okay? So, bakit na iba ang pangalan ng mga variants? Pinalitan ho ito ng WHO para ho hindi siya discriminatory sa isang lugar but still easy to remember. Okay? So, letter B po. Ayan, what is the Delta variant? Okay. Balikan po natin first. Before we go to Delta, let's go to Alpha. Ano nga ba yung Alpha variant? You can flash Alpha variant ngayon. Alpha variant, yan po yung dating UK variant. Okay? That was the formerly known as the UK variant. The UK variant po, or ngayon na we are not allowed to say UK, Alpha na lang po. This is a mutation po or derived from COVID na naiba po yung genetic code. It became a mutation or a variant of the COVID. And ito po yung kumalat sa UK. Right now, in the world, ito po yung predominant variant. Okay, puntahan po natin si Beta. What is Beta naman? Beta po is the South African variant. Yan po yung second na didiskubre. It was in South Africa. Okay? Number 3. Ito po yung Gamma. Okay? Yung gamma po, also called the Amazon gamma. Yan po yung Brazilian variant. Okay? That came out of Brazil, kumalat po and caused a surge in Brazil. So nandito na tayo sa Delta. What is the Delta variant naman po? It's actually called the double mutation kasi po it's not only one mutation but double mutations along the spike that make it even more nakakahawa and even more po, mas seryoso po yung sakit caused by the Delta variant. So Delta, also known as the Indian variant, kasi po it is the one that predominantly caused the surge in India and killed po hundreds of thousands of people. So number one, very important issue to remember about the Delta virus. It is a double mutation po. It is more infectious than the Alpha. Kasi yung Alpha is more infectious than the original COVID. So ito po si Delta, mas nakakahawa kesa sa Alpha. So as the variants progress, they get worse and worse. So 50% po it is more nakakahawa than Alpha. And sinasabi po nila out of a study po that came out in Scotland, 2 times po siyang mas seryoso po kasi yung mga na-ospital, if you get the Alpha, you might get hospitalized, but if you get the Delta, 2 times po more common ang hospitalization ng mga Delta kesa sa mga Alpha. Okay? Next question po. At saan ang Pilipinas? Pilipinas po is Theta. Okay? Pilipinas po is Theta. Okay? So let's go po to question letter C. Parang nadaanan na rin ho natin yun eh. Paano ba naiba ang Delta variant? As I mentioned po, no, mas nakakahawa at mas seryoso po ang Delta variant. Okay? How do we know na mas nakakahawa ang Delta variant? Sa US po, 1/5 or 20% na po ng mga kaso sa US is now identified to be the Delta variant. The other 80% is the Alpha variant. Okay? And in the India and the UK, ang bilis-bilis pong kumalat ng Delta. 90% na daw po ng positive COVID sa UK at sa India is Delta. Okay? So 10% na lang po ang Alpha. So basically, ang nangyayari po within this month or the next month, experts see the Delta virus becoming the more dominant worldwide virus. Currently, it's in 80 countries. Okay? Next po. What is the solution? Well, sa atin po, no, first of all, what's the situation sa Pilipinas? Okay? And where? Okay, before we can go to the solution, saan ba manggagaling ang Delta variant? Is it going to come from inside the Philippines or outside the Philippines? Ang Delta variant po will arrive in the Philippines from outside of the Philippines. Kasi we are an island eh, so wala pa akong Delta dito. At least, I hope wala pa. But manggagaling po, there will be a traveler, whether that person will be a foreigner, an OFW, a returning Filipino, hindi po natin alam yon, okay? But there will be a traveler infected po with the Delta virus na makakalusot po dun sa ating PCR testing na nire-require po before you board the airplane in another country, or baka may nakatabi siyang Delta in the plane or in the waiting area o habang nakapila sa passport, and that person will be positive and that person will be able to enter the Philippines, and pag nagkalat po yung Delta dito, we are very much in danger because majority po ng ating mga Pilipino ay hindi pa po bakunado. So what is the solution po dito? The solution talaga is to be very, very, very maingat po sa mga darating po sa airport. Our airport protocol is 14 days. So halimbawa po, on the day na you're boarding the airplane, dun ho kayo na nahawaan. For sure, in the 14 days po, may lalabas na pong signs and symptoms. And after 14 days, karaniwan po, most of the persons are okay at hindi na po nakakahawa. So that is the only time that the government will let you out of the quarantine facility. And ako po, I strongly advocate and support po nitong strict quarantine kasi right now, as of now, wala pa hong Delta na talagang kumalat pa ho sa Pilipinas. Latest balita po, there were 17 positive travelers with Delta virus. Thank God naman po, sila po ay na-quarantine. One of them died. Ganun ho ka-serious, no? One of them died. And right now, we are still po in the process of strictly quarantining all travelers kasi dun ho talaga manggagaling ang Delta. Okay, next.
I think, Doktora, that's all po.
Okay. Um, Moving forward
Meron pa,
naman
leading
po,
forward
ayan, merong
po sa
Delta
Delta
Plus.
Plus.
Unfortunately, meron nga pong Delta Plus. And Delta Plus is coming out rin po na mas pa rin ho nakakakawa sa Delta. So basically, we're in a difficult situation na more and more COVID variants are coming out. They are proving to be more infectious as they go along. Pero I'd like to reassure everyone, wala pa rin ho namang study that the vaccines will not be effective. All studies have shown po that the vaccines, any brand, are still effective versus the Delta variant. Kaya lang, kailangan po talaga dalawa po yung bakuna. In other words, is you need to take first dose and second dose para po maging protected po kayo. May balita po, not the Pfizer, there was a study, sa Pfizer po, 90% ang second dose. Pero pag first dose, 33% lang. So talagang kailangan po matapos ang second dose. So yun po yun. For everyone, what is the solution? Solution number one, keep out travelers and strictly quarantine them for 14 days. Solution number two, bakunahan na po lahat ng tao sa Pilipinas as fast as we possibly can. And solution number three, kung hindi pa po kayo manabakunahan, the mask, the face shield, and the social distancing are still all very effective versus the Delta variant. So yun lang po. Vaccination, pag-iingat po, and strict quarantining of travelers. Yun po ang ating solusyon so that the Philippines, God willing, may be spared po from the Delta variant. Maraming salamat po and magandang hapon. You are welcome to put your questions po sa baba. Okay?
From Ms. Rosario Cataina Gionzon, ano po ang symptoms if Delta variant?
Ma'am Rosario, thank you for asking this question. This is a really good question. Kasi, people always ask this, no? Iba ho ba yung sintomas? What I would say po is the symptoms are the same because the illness is the same. COVID pa rin eh. Kaya lang, what I would say is, di mo nyo ba napansin, Reyna, na before the surge, when people used to get infected with COVID, isa lang o dalawa lang sa isang pamilya? And then biglang nung nagka-surge, biglang 7 people in the family, 9 people tinakbo na. So that is the sign na when the actions and yung nangyayari to the virus changes, then talagang it gives us a sign and a clue that we are not dealing with the old variant but there is a new variant. So ang balita po talaga, we're still learning po the exact symptoms, pero what I am hearing po is that it is very fast and it is very deadly. So yun po yun. Halimbawa, what do I mean by very deadly? Diba, bata ka pa lang, and then biglang ang dami na hong batang na-admit sa ICU, ibang issue na po ang hinaharap natin. And we may be looking at the Delta variant. So, the symptoms and the signs like inuubo, linalagnat, it will remain to be there. But baka magulat ho tayo na biglang ICU-able na yung mga COVID, samantalang dati, they were just there at home or they were just there in the hospital. Biglang ICU silang lahat. Ang meaning nun, there is a variant at work. So yun po yun. Once we see na the actions, halimbawa, one office, one person became positive, the next day 50 persons are positive, may iba na hong nangyayari dyan. And that may be a sign of the Delta variant coming in the country.
From Ms. Jomari Bulanadi Maris, Happy Fiesta po. God bless.
Happy Fiesta, Jomari.
From Mr. Mark Joe Carlos, Happy Fiesta.
Hi, Mark Joe. Thank you. Happy
From
Fiesta
Ms.
po. Di ba
Janelle,
Apong San Juan?
from Mr. Janelle Kodnob, Happy Fiesta, Doktora.
Hi, Happy Fiesta.
From Mr. Jack Santos Tupas, Good PM, Doktora Ana, and to the team po.
Hi, Jack. Kumusta? Thanks for greeting Reina and Kat.
From Mr. Jeanette Articona Brosas, Doktora, need pa din ba ang first and second dose kahit nag-positive na sa COVID? I had my first dose done na po.
That's really a good question. I mean, because marami rin naman na positive na Pilipino sa COVID, and some of them are wondering, I've already had COVID, do I still need a vaccine? The answer po, ma'am, is yes. Why would that be po? Kasi, yes, you will produce antibodies po pag na-COVID kayo. Kaya lang, hindi pa po natin alam kung gaano ka-stable po yung natural antibodies or the ones formed from the COVID itself versus the antibodies formed from the bakuna. So yung from the illness itself, ang balita po or anecdotally, no? Ang ganda sa ano eh, ang ganda sa ano English, anecdotally sa Filipino nababalita, parang chismis eh. But anecdotally po, people would say and scientists would say na 6 months po ang antibodies po ng natural infection. Whereas, yung vaccine infection po, pinag-aaralan ho kasi talaga yan. So, tinatrack po yung mga volunteers dyan. There is news coming out that really the immunity produced by vaccines is longer and more stable than that produced by natural infection. So ma'am, kung kayo po ay na-COVID or if any relative of yours ang na-COVID, then advise them that despite being having antibodies from COVID, kailangan din po silang magpabakuna. Kasi po yung antibodies na makukuha nila sa bakuna, longer and more stable. Okay?
From Miss Remedios Nogoy Jeronimo, sakit daw po ng ulo ang symptoms.
Yes, that is one of the strong symptoms po of COVID.
From Miss Rosario Cataina Dionzon, why is it more deadly than simple COVID?
Ang explanation po dyan, Ma'am Rosario, mas pumapasok daw siya at mas mabilis po siyang makapasok sa mga cells. The spike protein is able to enter the cells faster. At dalawa pa ho ang mutation ng Delta versus the others na isa lang. So, ang bilis niya pong makapasok sa cells and ang bilis niya pong mag-take over ng cells. So, one of the cardinal reasons po that people say that sa Philippines, how come people do not die? It's because mababa daw yung viral load. Okay? What is the meaning of viral load? Konti lang yung virus na pumapasok sa katawan ng Pilipino kasi po naka-mask at naka-face shield. Yun ang, again, anecdotally, people say that and doctors say that. However, kung ang bilis pong makapasok dun sa cells po ng tao, yung Delta variant, halimbawa 100 ang sinabog, 100 ang pinasok, yung viral load natin mataas. Kasi it can easily enter the cell and that is what causes it to become more deadly. There's a question that you might ask, bakit, doktora, mas nagiging serious ang mga variants? Kasi ganito po yun, mami. Once a virus enters the body of a person, it needs to reproduce. Kailangan ho niya i-take over yung katawan. So, gawa siya ng gawa ng COVID. Mga anak ng COVID, kumbaga. No? Yung mga anak po ng COVID na yon, they have to keep replicating their genetic code because that is how reproduction occurs. By replicating the genetic code. Sa kabibilis ho ng replication ng genetic code because the virus is rapidly reproducing, nagkakaroon ho ng pagkakamali. There are mistakes in the genetic code that will occur. Now, these mistakes in the genetic code can either cause three things, okay? Either lalakas yung virus, hihina yung virus, or walang epekto po yung genetic code mistake. Okay? So, kung humina po yung virus, that variant will just naturally die. Kung lumakas po yung variant, that variant will eventually take over. Kasi siya yung pinakamalakas dun sa mga COVID. So, parang, siya yung papangibabaw. Ganon. And then, as it becomes, as it is more deadly, it seems to take over. And siya na po yung papangibabaw. Parang boss virus na siya. Ganon. It becomes the prevailing variant that will go around the world. So, ganun po yun. And it's kind of scary. How do we stop this? It's by rapid vaccination. Kasi po, pag mabukunahan na po lahat ng tao, wala na pong malipatan yung mga viruses. Once wala po silang maripatan, they will die. So, they cannot reproduce. If they cannot reproduce, then they cannot produce variants. Okay?
From Mr. Timoteo Bondoc,
I would like to state, no, this variant. Sige po.
From Mr. Timoteo Bondoc hi Doktora, good afternoon po. Normal lang ba na makaramdam ng symptoms para masabi na effective yung vaccine? Thank you po.
Yes, these are what we call po side effects. They can cause po yung local side effects po, bibigat po yung inyong kamay, possible na slight redness, pwede pong may heat. yung ano ho, systemic side effects or yung side effects po na sa buong katawan, you may feel feverish, para po kayong manghina. Some people feel sleepy, ganun po, no? These are all signs that our immune system is working hard. Kasi po, sometimes yung nararamdaman ho natin when we get sick is not necessarily the effects po of the bacteria or the virus, but the effects of our body fighting. So yun po yung nangyayari. Our body is producing antibodies to the vaccine that was injected in our body. So don't worry po, side effects will happen. Talagang hindi po maiiwasan yan. Though some people won't have side effects. But what I would like to say about the side effects is malilipasan naman po natin yan. For those naman po na totally walang side effects, wag naman kayong kabahan, oh my God, baka tubig ho yung binakuna sa akin. Someone sent me that message and that person was my cousin, okay? So, I would like to say, kung wala po kayo naramdaman na side effects, that's okay also. Iba po ang katawan ng tao. And your body is still working. Trust that your body is still working. Okay?
From Mr. June M. Todinho, good afternoon po, Doc.
Sir June, how are you? And magandang hapon po.
From Miss Jeanette Articona Brosas, good afternoon po, Doktora Ana. God bless.
Hi, Jeanette. Thanks for your question kanina. Napakaganda.
From Miss Remedios Nogoy Jeronimo, gandang hapon po. God bless you more po.
Hi, Ma'am Remedios. Good. God bless you din po. And thank you for joining us.
From Miss Corazon Rafanan Espejo, happy fiesta, Doktora. Good PM po.
Ma'am Corazon, magandang hapon po. And good happy fiesta. Thanks for the greetings.
From Miss Rowena S. Viray, hi po, Doktora. God bless.
Hi, Rowena. Magandang hapon.
From Mr. Boy Camarillo Manalastas, hi po, Doktora. Taga Makabebe ako. God bless po.
Wow. So am I. I'm also from Macabebe.
From Miss Irene Soto Sobrevilla, thank you po, beautiful Doktora, for sharing your knowledge. God bless you more po. Ingatan po kayo ng Diyos. From San Miguel, Bulacan.
Wow. This lady is our neighbor. She is not Kapampangan, but the town po, San Miguel, Bulacan, is right next to Candaba, Pampanga.
From Miss Rosario Cataina Johnson, the effect of vaccine is lifetime or do we need a booster?
Ang ganda rin po ng tanong na yan, and thank you for asking that. A lot of people, yan ho talaga is on their minds right now. What I could tell you po is right now, we cannot know the answer to that question. I would like to share with you that the flu vaccine is given yearly. So it is not abnormal po to require boosters. Ang tetanus po may booster, ang measles may booster. So hindi po, it's not, COVID will not be the first vaccine in the world to require a booster. But at the moment, we do not know the answer po to that question. So my best advice po is, after you've been vaccinated 2 times, continue to wear a mask and a face shield and socially distance, and then maghintay na lang po tayo for further information. Right now, nobody can answer po. But thanks for asking that. Ang daming nagtatanong yan.
Next po, Miss Kat.
Okay. That's it.
That's all that we have po.
Okay, so I would like to invite everyone tomorrow. Tomorrow po, we have a special guest. His name is Dr. Ryan Cablitas, one of the best urologists po in the country. He's very young. Ang pag-uusapan po natin is common childhood urologic problems o problema po sa ihi at sa ari po ng mga bata. Okay? One of the topics that we will be discussing is pagtutuli, circumcision. Okay, about this, Reina, as a mom. You're also a mom of a boy, no, a little boy. And Dr. J has conducted circumcisions every year for ano po from the time he's been mayor. And last year, due to the pandemic, hindi po kami nakapagtuli. Libo-libo po yung tinutuli namin every year. This year, hindi na naman po kami nakapagtuli. So, marami po akong nakita, no? There's a question. Is pagtutuli considered a pandemic emergency? And dapat po bang, kasi right now, ang inooperahan lang yung mga serious cases po talaga, which is cancer, vehicular accidents, orthopedic emergency, ganun po. But as a parent, let's say your child was 12 years old before the pandemic. How do we know when the pandemic will end? At kailan po kaya matutuli si Junjun? Oh, the question, is pagtutuli a pandemic emergency? How about the psychological health po ng inyong anak? So that's a very good question. Ikaw, Reyna, what do you think?
Nako, na I am with you on that, Doktora, kasi when I was a nurse, kami din nauutusan kami sa mga rural and rural areas talaga, pati mga bundok. Nagtutuli din po kami. Kami po yung nauutusan minsan ng mga doktor. Ngayon,
O
medyo
yun na nga.
alarming nga
Paisipin mo,
siya.
let's say, yeah, kailangan mo, diba? Assuming March 2020, you were 13 years old. Already ka na magpatuli, diba? Or sabihin natin 12 to 13. O ngayon, 2 taon na. You're already 15. My gosh, what's going on? Oh, sagutin mo yun.
Yes, and we all know na kapag nagpapatuli po, lalo na sa mga barangay level, madamihan po talaga. So we cannot do that now. Kasi may presence of COVID.
Oo, at saka ano nga rin, 'di ba? Right now nga sa mga ospital, before you undergo a procedure, kailangan ma-PCR ka. O paano 'yun? Who can afford a PCR sa barangay sa mga natutuling bata? You know, you might think it's funny, but if you are the parent of the child and worse, you know, mga adolescents, mental health, I mean, self-image nila, yung, you know, they're already stuck. Lahat na, no? I mean, it's a serious problem. Kasi usually sa mga Pilipino po, the right of pagtutuli, parang ano yan eh, rite of passage yan na magiging binata na sila. What? Hindi na sila binata? Oh my gosh.
Actually, Doc, biblical din ang pagtutuli, di ba po? Yan, tama po kayo. Rite of passage ang tawag nga po siya dun po sa ceremony ng mga pagtutuli po.
Yeah, di ba? Pag natuli ka, ang ano doon, binata ka na. O paano yun? Hindi ka na magbibinata. Oh my gosh.
Plus in medical,
So,
Doctor,
we'll talk about this with Dr. Ryan.
Para lang din malaman ng karamihan, in medical, kaya din naman talaga tinutuli is for hygiene purposes. Tama po ba?
No, definitely. Yung STDs bababa at saka HIV bumababa.
There you go po. Ayun, exciting
Yeah,
tomorrow.
Yeah. Yeah, it's a very something that I would really like to know. And for parents po na mga twins at saka teenagers po na lalaki, ang hirap nito hindi
Oh
biro
my
ito.
God, I can't imagine, Nora, si Aki.
Si Aki ba hindi pa natuli?
No, he's just, oh my God, 3 years old.
No, kasi another question, no.
Yes,
There's a valid
question.
reason
Yes.
for this question. One of the things that I'm going to ask Dr. Ryan also is, kasi nung pinanganak yung yung anak nung kapatid ko, they asked me, dapat bang tuliin si Diego habang newborn? So that's another thing that I wanted to ask Dr. Ryan about. What are his thoughts?
Yes.
What are his advice on newborn circumcision? Dapat ba o hindi? So I really think those are all
Yes.
very good questions that need to be answered. And
Yes, I agree, Doctora.
konti lang po talagang gumagawa ng mga topics na ganito. Very practical. Sometimes you might think they're funny, but they're actually very much necessary. So sa inyo po lahat,
Yes,
thanks for joining
I
us
agree.
today on the Delta variant. Thanks, Reina, for sharing with us your thoughts. And we'll see you tomorrow po with Dr. Ryan Cablitas, a urologist at 4 o'clock po ng hapon. Our topic is pagtutuli po and other urologic procedures po sa mga bata. So sa inyo po lahat, magandang hapon po and mag-ingat sa Delta variant.